Hi, my name is Rick Olderman. I'm a physical therapist and somatics practitioner, and I wanted to talk to you about the connection between stress and chronic pain. Tension is one of the biggest problems that we face in terms of solving chronic pain. And what we're talking about here are emotional trauma, societal pressures, pain, systemic issue, even your personality type. If you're a type A person who just can't seem to relax, well, that tension remains in your muscles, and your muscles remain tense and firm and hard all day long, which can create stress to joints and muscles and so forth. What I want to do is introduce to you the idea of the sympathetic nervous system. This is our fight or flight nervous system. That's originally it's made to help us fight off attacks and immediate threats. However, in our modern day life, threats are ongoing. Stressors are ongoing, and they don't just come and then go. We have to face these day in and day out, sometimes for years at a time. So the sympathetic nervous system then remains on for years at a time, and it can create a lot of problems for the body. Stress has been shown to increase our propensity for becoming sick. There was a study done where people filled out this schedule of life events, which predicted their likelihood of becoming sick based on their scores. Now, it's not a far cry to see how this would work with creating chronic tension and pain in the body, musculoskeletal pain. I want to introduce to you another player in this stress and chronic pain equation, and that is the fascia. And fascia is connective tissue that binds everything together in the body: muscle, bone, blood vessels, nerves, everything. There are fascial highways in the body, and what I mean by this is that the head is connected to the foot via these strong lines of fascia in the body. Now, what you're looking at here are muscles, okay? But fascia is wrapping around and investing in all of these muscles and connecting muscles to muscles, muscles to bone, bone to bone, and so forth. So that's why this is considered one contiguous piece of tissue. In fact, this fascial highway can be dissected from the body as one contiguous piece of tissue. So it all works together collectively. Here are some others. Here's another fascial highway along the sides of our body. Here's one that addresses rotational issues at the body. These are the upper extremity fascial highways. So fascia has a unique property whereby in areas of mechanical stress it lays down something called myofibroblasts. Now, what do I mean by in areas of mechanical stress? Well, here's an easy one. Our spine has natural curves in it. When the spinal curves are under stress, and usually it's at transition zones, for instance between the pelvis and spine, or between the head and the cervical spine, or the cervical spine and thoracic spine, in these areas, these are transition zones that undergo particular stress in the spine, and this is where myofibroblasts are laid down most. But it can happen in other areas of the body as well. Sometimes excessive stress is placed on these curves, and here's a situation where this would happen. Pregnancy. Well, the pelvis tilts forward, the lumbar spine undergoes extensive arching here, which creates stress, and so myofibroblasts may be laid down in this situation. Here's another situation where the scapula are being pulled down, which creates cervical stress. Here's another situation where tight chest muscles can create stress at the shoulder joint. Another one where the shoulder is not tracking correctly, that can create stress, and more myofibroblasts would be laid down in this situation. If the latissimus dorsi is too tight and you do a lot of overhead work, then that creates arching of the spine and again contributing to stress in the lumbar spine, which would be a condition where myofibroblasts might be laid down. If your hip flexors are too tight, it causes the lumbar spine to arch excessively, again contributing to stress here, and another situation where the myofibroblasts might be laid down. If your hip flexors, again, are too tight, it can cause one side of the pelvis to tilt to one side, creating side bending at the spine, again, another stressor. So myofibroblasts have up to 4 times the contractile capacity of normal fascia. And they're not responsible to neural input like our muscles. So a nerve doesn't connect to these myofibroblasts. Instead, they respond to chemical messengers called cytokines. And they respond to a particular cytokine called transforming growth factor beta 1, which is triggered by the immune system. The release of this is triggered by the immune system. Well, guess what? The immune system is triggered by the sympathetic nervous system. Remember that first player that we talked about in this little video? The sympathetic nervous system is triggering the immune system to release, to trigger the release of the cytokine, which then causes the myofibroblast to contract. Those myofibroblasts are in all the areas of your body that are undergoing mechanical stress. So this is one possible mechanism by which our emotional tension, which is activating the sympathetic nervous system, can create physical tension and therefore pain. I also want to point out that there are other, in the beginning we talked about, in the list there was a systemic issue, and this is where I wanted to talk about this, is that our viscera have overlapping innervations with our musculoskeletal system at our spine. So our viscera don't have an ability to sense pain. However, if something is wrong in the viscera, there are nerves that go to the spine, and those nerves will be at similar levels of various musculoskeletal levels. And so by virtue of them sharing the same vertebral level, they can then cause musculoskeletal pain. And it's one way for our body to tell us that something is wrong with our insides. So if you have, let's say, a heart issue, it's common knowledge that if you have a heart issue, you could have left-sided jaw or neck or shoulder pain. And it's because they share the same level of innervation in the spine. If you have, say, pancreatic issues, that shares a similar level, and you could have back pain. So diaphragm issues may involve a scapular pain or shoulder blade pain. So because we share these levels, our viscera can influence how our musculoskeletal system is working. And here's a picture of some of those innervations, and you can see, if you just trace this, you'll see how, at what level of the spine, these different areas are activating, and therefore potentially activating the musculoskeletal system at the same level. There's an interesting study called psychoneuroimmunology, which it's the study of just what this video is about, the combination of mind, body, immune system, neural system, how all of this works together to create pain. So the gist of this is that it makes sense to address emotional and lifestyle as well as physical stressors in our lives. Stress is a big deal. Now, here are some ways that you can reduce stress and chronic pain. Well, this Fixing You Interactive Online Clinic, for one, is a great way because we have lessons in somatics which are designed to decrease sympathetic nervous system output as well as relax muscles. They're very calming exercises, and I hope that if you have stress as a component of your chronic pain, that you linger on that lesson that deals with somatics, because it will benefit you tremendously. Now, other ways that you can reduce stress is through meditation. You can go to counseling. Personally, I have just found that if I feel stressed and I do something nice for someone else, it really decreases my stress level. So volunteering is a great way. Getting active, donating, helping others, all of these things make us feel great about ourselves and therefore decrease our stress level. So try that out. There's another practice called Hanna Somatics, and I am a practitioner of Hanna Somatics, and it is a technique that helps reduce muscle tension, and Hanna Somatics is the somatics that I'm referring to in this lesson. Well, where do I go from here? Well, you can go to fixingyou.com and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to fixingyou.com and join the Interactive Online Clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.